parents took her to the doctor after she got her first period at 12. Now, when someone gets their first period at 12, you would expect that, okay, yeah, by the next month, which is the next cycle, after 28 days or so, you're expecting another period to come. But what happened was the period did not show up after a month, which is like the basic average that most people get their periods. And then the parents became worried. What is happening? Is our daughter pregnant? And then they decided to go to the doctor. They went.
Hello there. You're welcome to our Health Hour, your go-to podcast for informative discussions around women's health. In the gym, your car, kitchen, or wherever you decide, tune in every 2 weeks for new hot topics you don't want to miss. And hold on. Do not forget to follow us on all our social media platforms so you join the conversations at our Health Hour.
Hello everyone, you're welcome to another episode of our Health Hour. This is your go-to podcast for everything related to women's health. Here we talk about different topics unfiltered, and we are happy today to record another episode. And with me in the studio is
Hikmat Shole. Welcome to another beautiful episode of her Health Hour, and today we're taking a very, very important topic, so I can't wait to share with all of you guys.
Yeah, of course, and I remain Balikis Abubakar. So as Hikmat said, the topic for discussion today is one that is very important, and honestly I think it affects every woman listening to this episode. This is a topic that you want to really grab a seat and let's discuss it, because you never know when this is going to impact you in a very difficult way. So you might already be guessing what we want to discuss about, but let me just let the cat out of the bag. We are discussing something called the gender health gap. So have you ever gone to a doctor appointment and you are thinking, I don't think this doctor is understanding what I'm saying, or I feel like my opinions are being dismissed, or you hear things like, oh, you don't need to exaggerate, this affects a lot of women. I know it affects a lot of women, but you need to give me more information about this. So if you've ever felt that way, that your views are being like pushed aside, or you are not really getting the information you need from your medical professional, or you are being told that, oh, you are just being stressed, it's not something serious, or it's just your period, or this is what happens to you as a woman, then come here, because this is something that has a name. It's called gender health gap, and it's simply the gap that exists between how men and women are being treated when it comes to getting health care. So this covers things around how women-related diseases are being researched. It covers how women-related diseases are being diagnosed, and we'll be delving into this topic, talking about how there's a gap in the science space when it comes to researching women-related health issues, and how we can really address this situation, and what you also can do to advocate for yourself. So Hikmat, I think I'm really excited about how we dissect this topic, and yeah, I think we can just go straight into it.
Yes, thank you so much for that wonderful intro. First of all, like Balikis said earlier, this is a very, very important topic. As a woman, or even as a man, you have to be aware, and that is what this space is all about. We create awareness about things that are not really spoken about. So in the gender health gap area, what I would like to start with today would be the research bias. So the medical research bias. So for decades now, the research, diagnosis, and treatment has been based on just men's body. And the anatomy of a man and a woman are completely different. So women are treated as an afterthought when it comes to that. And they don't do it on purpose, to be honest. It is just because there's lack of funding, research women's health challenges, and also the fact that they're scared that during like a clinical trial or clinical study of a particular ailment or a particular disease, they're scared that a woman might get pregnant in the midst of everything and maybe just ruin the whole research. So they end up just basing it on just a man's anatomy, and the woman is pushed aside completely. So for decades, this has been happening. So when it also comes to medicine, the drugs that are prescribed because the research was based on a man, it affects us very, very differently. There's another challenge to it. We don't experience the same symptoms. So a man, take for example, heart attack. A heart attack, the classic symptom we see in the movies. You see someone holding onto their chest and, they're falling to the ground and eventually, maybe they die eventually, or maybe they don't die. But for a woman, it is quite different. For most women, it's quite different. And you won't believe, I was actually shocked when I read that. For a woman, you would be experiencing constant nausea and, the pain in the jaw or fatigue, which are quite, if you look at it, is mostly common amongst women. So we can actually say heart attack is a silent killer in women just because our symptoms are not the same as the men experience it. So just imagine how many women have died because when you're nauseous, it does not instinctively come to you to go to the hospital. When you feel nauseous, when you feel fatigued, people will tell you, okay, if you're nauseous, maybe you have a fragile belly. Maybe you had something to eat that does not sit right with you. But not in anybody's wildest imagination would it ever come out as, I think you might be having a heart attack. That would not be the first thought. But then that is where the fear is, because that could actually be what is happening in the moment. Symptoms differently from a man, we end up dying. And that is one biased illness that medical research didn't actually really do for women. So it's not really looking good at all.
Yeah, I really like what you said, Ima, about this being like even a research gap issue, because that then means that it's a systemic problem. Because when we look at it, what you said about male bodies being used in research, even when the disease could happen to anyone, irrespective of the gender, it means that women symptoms can easily be missed because the medical textbook are even like missing it entirely because there's no enough research being done in that regard as to using a woman as case study or using women bodies during the research. So ideally, we need more researchers as women. We also need more women being involved in research, because what you said about heart attack is, it just brings it into perspective that if symptoms are not being recognized, then it can be missed. So this is a serious issue that is not just about your doctor dismissing you, but it's something that is already baked in. It's a systemic issue that really needs to be addressed. And I believe that things are improving now. More funding are going into women-related issues being researched, and we're also like seeing more advocates coming out on this, which is going to help, but there's still enough room for improvement in that regard as well. So another aspect that I would like to discuss is how most times they tell you that as a woman, if you are facing different issues, you're having very painful periods, they tell you this is just normal as a woman, and sometimes they tell you it's all in your head. Being most of what you're feeling are being like categorized as maybe stress kind of thing, and not really, they don't really investigate the underlying causes of some of the symptoms. And I'll put this into perspective. So do you know that women are most likely to spend 16 minutes more in A&E? So this means 16 minutes extra time waiting to be seen, even in an emergency. Now, 16 minutes might sound like it's just small, but when you are in pain, trust me, that's going to be like waiting for 16 years. And why this happens is because, there's just that perception that it's either you're having just a normal painful period or something, but it could be something more than that. It could be endometriosis, for example. And even we've seen that many times endometriosis, it takes up to like 6 to 10 years before a woman is being diagnosed of this condition. 6 to 10 years of your life, being told that it's normal and you are being sent back home with a painkiller. This is so disheartening, honestly. And we've seen many women, think that this is just like an infertility issue, but it's beyond even fertility. It's something that can affect every aspect of your life, your health, your work life, and even how you are able to socialize and perform in the society. So we see that there's like that situation whereby there's no enough advocacy when it comes to women's health, and many times women are being dismissed. And interestingly, this is not only happening in medical field, but we also know that even like not until 2011 was car crash dummies involved using women as well, as because many of these car crash dummies, they just use the male figure for it, and you never know, right? Women are also like 4 times likely to get involved involved in a car crash. But if the dummies are not inclusive of women figure, then they can miss certain important parts that could, be put into perspective when designing different things within the car to prevent car crashes from happening. So this goes beyond just medicine. It covers like different areas as well. So it's important that you advocate for yourself and you don't just go to an appointment and let a doctor tell you that, all of this, I know you're experiencing it, it's normal, you can feel this way, it's normal, and it's just in your head. You need to be able to speak for yourself and do your research before you go to an appointment. Don't just take one opinion. Try and seek other opinions as well so that you can make an informed decision about what you're going through.
Yeah. That's a very, very good point, Balikis. And when you mention women waiting 16 minutes more than men in the E section, yeah, what that means, and you said they would just usually assume that she's here for maybe a period-related issue or pregnancy-related issue. But I don't like the fact that women's health is being reduced to only our reproductive value. Because period and pregnancy, they are all part of reproduction.
Yeah.
Women's health does not only involve reproduction. It also has to do with our mental health. So our digestive health is there, our heart is there, other organs too that are not part of the reproductive system are also involved. So when a woman is complaining of other things, just because women are generally believed to exaggerate more than men, they don't take them seriously. You go to the doctor and, you go to the A&E, you're screaming in pain, like something is really happening to you. And because a man is screaming, they feel like it's more believable when a man is screaming than when a woman is, because they feel, she's just being emotional, she's just exaggerating, just because we're naturally more emotional. So they would say, she's exaggerating her symptoms. But when they say a man, they'll be like, oh my God, this grown man is groaning in pain. It must be a serious thing. So apart from the clinical research that wasn't done mostly on women, it is also very, very deeply psychologically ingrained, because the society look at men as the stronger person than women. So for a man to be groaning in pain, it means his situation is more serious, and that leads to them getting more attention than when a woman is actually in pain. But then it is very, very contradictory, because women go through serious pains with regards to maybe while trying to give birth or even menses. I don't know if you've seen some videos going around with women trying, or just men generally trying, some labor or period stimulation.
Yes, I've seen that.
Good. So in such cases, you see women, even when the machine is fixed to the highest level, or the highest function, the women can somehow still bear it. Because from a young age, we're programmed to think period pains are normal. This is normal. Pregnancy difficulties are normal. Labor pain is normal. So for some reason, we have psychologically just ingrained it ourselves to just, deal with it. We do everything regardless, even if we're going through such excruciating pain. And then you see the men, even in the first level of trying the labor stimulation or period stimulation, cramp stimulation, they can't even handle it.
They can't withstand it.
So just because somebody's pain threshold or somebody is, they're containing it, doesn't mean they're not feeling it. So it is not just about people that have been in the system, that have been doing the clinical research. It is also very psychologically ingrained. So as a woman, if you feel like, this is not normal, this is not how I used to feel. And even worse still, there are people born with medical conditions that they don't even know what normal feels like in the first place. So you should always complain. If one person is not hearing you, fix an appointment with someone else. I mean, kudos to the healthcare system. Sometimes you're able to choose who you want to see. So if somebody doesn't sit right with you, you can, they're in the same field. So you can actually make a decision that, you want to see someone else. Maybe you feel more heard by the person. So you're actually allowed to choose. But if you don't have the access to using someone else, then you can seek a different opinion. Maybe go to another hospital, even if it seems far away. So when it comes to issues like seeking another opinion, it is worth it. So you can't just, because somebody says, no, you're all right, and you're not feeling all right. Sometimes you have to trust your instincts and seek another opinion. Maybe you might even choose a private medical center or whatever, just to bypass what someone else is telling you, just to be sure that everything is okay. Right? So that is one thing that I would, like to mention when it comes to, the bias in the healthcare system.
I agree with you. And also we need to remember the emotional cost of everything that you've mentioned, because when many times you are being dismissed, not just by one, by two, other medical professionals, because if you remember what we said at the beginning, this is not just a character issue of one medical professional. It looks like a systemic problem, right? So you can book appointment with 3-4 doctors and you hear the same thing. It's because that's the way they've been taught, and there's, as we said, there's bias in the research to start with, and there's bias in the society as to who handles pain more, and everything that Hikmat has mentioned. So you might see there's that pattern of having the same opinion, but that doesn't mean you should doubt yourself or doubt what your body is telling you, because it means that there's an issue that needs to be addressed. That is not just a you problem, but you shouldn't let that make them miss a diagnosis on your part, which could then have detrimental effect on you. So what do I mean in summary? As Hikmat has said, advocate for yourself. Even if it means like booking 10 appointments with different people and you are hearing the same thing, speak out. Sometimes you hear people go on social media and they talk about some of these things, and they might get help from there, because sometimes there's still like a large or huge research gap as to what is happening to you. Although we know the many medical situations that affect many women, the popular ones, but there might be some that are like specific, still less research in that area and all that. So speak up, advocate for yourself, and don't make any situation make you doubt yourself. Nobody knows your body more than you do. So there's an emotional cost of all of this that you might start feeling like, okay, maybe I'm actually really exaggerating. So don't let them get into your head. You know yourself more, you know what you're feeling, and just stand on that until you get an answer. Don't back down.
Of course, you might seek other opinion, but it doesn't mean that the person can also, not do the same thing, right? So it is just an option that sometimes just one person might not be enough to be able to determine what is wrong with you. Even if one person has the answer, you also have to, collectively, because sometimes misdiagnoses happen. There have been cases, even with something as small as, checking genotypes or blood types, mistakes that can happen. You can check with one particular hospital or a healthcare center and they give you a different result, and then you check with someone else and it's different, right? And this kind of mistakes can, be very, very catastrophic in a person's life, especially when those answers are very, very important in decision making. Yeah. So misdiagnoses are there, especially when it comes to women's health challenges, like maybe PCOS and endometriosis, as Balikis has mentioned earlier. You go to the doctor, especially as a teenager, because this is not just issues that affect grown women. For women, developmental this starts quite early. And imagine a 12-year-old girl that has endometriosis. How is she expected to advocate for herself? So sometimes when you think about advocacy, you're thinking, well, I can do it. I'm old enough, right? I can see when somebody dismisses me, I can stand up and say, no, this is not normal. Yeah. But for a 12-year-old girl, in fact, the younger girls, even as low as the age of 7, that are getting their periods. And if they have PCOS, if they have endometriosis, how do they advocate for themselves when they go to the doctor? Because even her mom cannot tell the extent at which she is feeling pains. She can't tell. So when the doctor dismisses her, even with her mom being there, they can't do much, because maybe sometimes you feel maybe she might just be dramatic as well. Because forget the medical experts, some children also can be dramatic. That's one thing. So she might be going through something that we also, as mothers or as relatives, we dismiss them as well. So unless you're a grown woman and you're able to advocate, even if you're able to stand up and say, no, this is not how it is. I used to get my period before. It didn't used to be this painful. This is different. So this is how much we should take this very, very seriously. We should take this topic very, very seriously, because it can be you, it can be me, it can be the younger girls that are helpless and they don't have anybody to advocate for themselves, and rightfully so, because they're children. So when you get a misdiagnosis, when you're telling maybe a doctor, because I've heard a story of a girl that had PCOS, but what happened was her parents took her to the doctor after she got her first period at 12. Now, when someone gets their first period at 12, you would expect that, okay, yeah, by the next month, which is the next cycle, after 28 days or so, you're expecting another period to come. But what happened was the period did not show up after a month, which is like the basic average that most people get their periods. And then the parents became worried. What is happening? Is our daughter pregnant? And then they decided to go to the doctor. They went to the doctor and the doctor said, your periods just started. You might be experiencing hormonal shifts. It's your first time, so you have to just sit it out and wait until it comes again. It is normal for some people to have it. Not everybody have regular periods. What? And they went back home. They were like, oh, what's happening? Okay, no problem. You just have to wait it out. And then 6 months later, the period did not come back. But because the doctor told them that some people experience it like that, it's normal, it will come back, they relaxed, right? Mm-hmm. And then they came back 6 months later like, could it be pregnancy as well? Right. But for a 12-year-old, all these things are overwhelming, right? When she herself your parents don't have answers to your questions. You yourself, you don't even have answers to your own question. Like, what is wrong with me? My parents are asking me if I'm pregnant. It is very, very overwhelming for a child that age to go through. And then they go back to the doctor, and that is when they actually offer a scan to see what was happening with the girl.
That's so late.
Exactly. So the first thing that came to mind when the period did not come the second time was pregnancy. So you go to the doctor, my period is late. And then the first thing is, we do a pregnancy test. So as long as you're not pregnant, it's normal. They sent her home, a 12-year-old girl. 6 months later, she's back. Still no period. She comes back, and then they offer to give her a scan. And then in that scan, she has polycystic ovary syndrome. And that is why her periods have not been coming. So imagine what she had to go through within that time, as because some parents would actually even start asking you questions. Where did you go to? Who did you see? It can affect the relationship of parents with their child, because the child knows nothing. And then you're bombarding her with questions, because it is all based on, if you do not get your period, then definitely you have been messing around and you're pregnant.
Yeah.
Just because there was not a misdiagnosis of
this is Hikmat, that story really puts this into perspective. As you said, like the level at which PCOS is even chronically underdiagnosed is very alarming. Many people don't even find out that they have PCOS until they're trying to get pregnant, and they will have been having the symptoms many years back. And the issue that you said about this girl might be the same thing that has happened to them. They started their menses early, they've started having the symptoms, but they keep being dismissed by family members unintentionally, and they keep, dismissing this in their head as well, that it's just normal. I usually will have painful period. I usually will miss my period. I usually will see that I'm having like a lot of breakouts. I'm growing beards. I'm like adding weight even when I'm trying to keep healthy. But you just keep dismissing all of these symptoms that you should have actually taken seriously. And even when you try to take it seriously, because of the systemic issues that we've highlighted before, you could even get dismissed by medical professionals that should help you figure out what's happening, especially when you are not in that childbearing age yet. And this means that what we are discussing today doesn't only affect women, even girls. So it's something serious, right? If a very popular female health situation or issue like PCOS is still being underdiagnosed, we are living in a bubble of different situation and different medical
issues that could lead to detrimental things. So Hikmat mentioned PCOS. Another major one could be autoimmune diseases. Like 80% of autoimmune diseases affect women. And you see conditions like lupus, for example, you don't really get the symptoms consistently. So you might have, flare up this week and next time you feel okay. So it's very easy to miss, conditions like that. And if you are not taking those symptoms seriously, or if you take it seriously and, even when you go seek for help, they're not really taking it. Oh, maybe it's just like rashes or something. And then next week, you're not feeling that. You're not seeing that symptoms. It's very easy for them to miss it. And then that's when it becomes something more serious and it might be too late by then. So even heart attack, as Hikmat said at the beginning of the episode, because the classic picture is, or maybe, as she said, the symptoms with chest pain, but we've seen that now, there are other symptoms that could be specific to women, like jaw pain, that might not be included in the medical textbook, which could make it easily be missed when a woman is experiencing that. And that's why women are more likely to die from heart attack than men, because their symptoms can easily be missed. So the summary of all of this is still advocate for yourself. Yeah. Take all your symptoms very seriously, because underlying medical condition, which could be a serious one, might be missed. We also touched briefly on this, but maybe we can go into more detail, and that's about how, as women, we carry much more than just being a reproductive element. Yeah, honestly, and the way the medical field, health professionals, the culture, the society, it looks at women first as, you reproduce. That's one of the key characteristics of being a woman. Yeah. But it's important that we start seeing beyond this, because if only a part of us that reproduces is being given attention, other parts can be missed entirely, which could become a serious situation. So when we think about it, we are looking at if a woman lives very long, and we all pray to live long, right? You most likely experience something called menopause. Yeah. And as popular as this is, considering the fact that it will affect every woman in a lifetime, if you get to that particular age, there's still a huge gap in the research around menopause. There's still a huge gap in the training given to medical professionals about how to treat a woman experiencing menopause. There's still a lot of awareness gap as to how a woman herself can even recognize that what she is experiencing is either premenopause or menopause itself. So there's a lot of work that needs to be done around the awareness, around the research, and around how medical professionals can be given the adequate training to be able to help a woman to understand what could be done. It might be, for example, maybe it's just HRT that needs to be given to a woman, and then she's given antidepressants. What she should get is, to say what HRT means, is hormone replacement therapy that could help improve the symptoms a woman is experiencing during menopause. So if there's enough research and enough awareness that a woman should be seen beyond reproduction, a woman's health is beyond reproduction, then there will be more research, there will be more funding given to other areas as well that could affect a woman, like what I said about menopause. What do you think about this?
Yeah. Menopause is a very, very fragile state. I would describe it as fragile because it is a stage. I think that's just like the last phase of a woman's reproductive life, I would say, because your reproductive system is shutting down. So all the processes that it started with at puberty level, the menses, maybe the women that went on to have children, and then everything is coming to an end. The menstruation is stopping, the ovulation is stopping, right? And without these two processes, it means you can't give birth anymore. So everything is shutting down. So I would say it's a fragile state because it has happened for a long time and it is stopping. So when you're at that level, everything might be heightened again just because that process is coming to an end. So at that stage, you really, really need all the help you can get with adequate diagnosis, like what is happening to you, because it affects women differently. Some people complain that when they're at the menopausal stage, this is not just about the period stopping. There are other things, some illnesses, their metabolism slows down, their hormones get heightened, some people get so irritable, some people lose hair, some people skin, they start breaking out and all of that. So when you're experiencing all of this, as a woman, sometimes it's always common to say, okay, yeah, it's only teenagers that have all this skin breakout and stuff like that. And then you're in your 50s or 60s experiencing this and you're like, what is all of this? Right. But it could be as a result of the menopause that that phase is coming to an end. But because we're not really educated about it, and then there is not enough research around how things like this could be handled. I mean, I would like an idea of when a woman is about to go into menopause, maybe when the periods have started delaying more than how it usually used to be. The cycle have changed. I would like for there to be like special attention for those women. Okay, maybe your hospital would invite you and say, okay, you're at this stage. Here is what is expected. Here is what you might experience. Okay, I'm going to prescribe this for you. Take some of these supplements, take some of these medicines. Tell me what you're feeling so that I know how to help you. Right? That would be such a relief and a lifesaver, and it will make you feel like you're not crazy, or it will not allow you to minimize your symptoms or just downplay them and say, oh yeah, I'm fine, where it actually affects you. So something like that would actually be a revolution, very, very good thing to happen if women at that age range are given the opportunity for a direct one-on-one with healthcare professionals for them to discuss their symptoms and, get adequate help, right? And be able to diagnose them properly and give them the proper treatment. So that would actually be a very good thing to happen. Yeah.
I agree with you. Honestly, it's high time that we start seeing that advocacy, funding, research around everything related to women's health, and most especially those parts that are not really related to reproductive health, because as we said, it will be good for the healthcare system to see the whole part of being a woman and not just that part of us that reproduces. I think it is also important for us to discuss that cultural angle as it relates to gender health gap. So what's your view about that?
Yeah, I was just coming there, to be honest, because the societal implications around this topic is very, very important. Now, as a woman, especially when in some areas that it has been normalized for us to minimize our pain or not talk about some certain things outside, there's still some people that can't talk about their menses outside because it's supposed to be a secret, right? You're not supposed to expose yourself like that. So imagine such a woman is having issues with her menses, and then you go to see a doctor. You can't speak because you already feel like it's a taboo to even talk about this. You can't even tell you. In fact, most likely you would never be at that doctor's office. You will most likely never even get there because you are not allowed to speak about it. Or you see you saw your menses, fine, deal with it. If you have a problem, you can't come forward because you would assume it is normal because you don't even know how other people have it, because you don't have that conversation with other people to even know what is normal and what is not. So as a society, I know that there are some remote places where maybe most of them are not educated, right? But there are other people as well that even though with the education they have, they still have that belief deeply, in them that they pass on to their children as well, to never talk about those things because our culture does not permit that. It is a taboo to speak about what you're feeling or what you're going through. So it is very, very important, if you're educated or you seek awareness, to be able to communicate and give an enabling environment to the younger generation and also to yourself, right? To allow yourself to speak up, to get the best healthcare treatment required for your problems.
Yeah, I agree. I agree with you, Hikmat. And when we even look at it, also, the reason why this cultural angle is very important is because we've seen that certain conditions affect people from particular kind of race more than the others. And we can take fibroid, for example. So we know that Black women are like 3 times more likely to develop fibroid. Or Asian women, for example, are more likely to develop like type 2 diabetes. So there's that racial angle when you think about some medical conditions, which you should be aware of. So as a Black woman, for example, I know that I need to take my vitamin D very seriously, because this will help me prevent likely conditions like fibroid. I need to so you pay more attention to this when you are aware about it. So that's why we need that awareness, very important, and we need medical professionals to also be aware of this. So cultural competency within the medical space should not be optional. It should be mandatory. So certain medical training should be given to the medical professionals. I believe this is happening already, but maybe we need more of that, so that when they have a patient from a particular race where there's high tendency of having certain medical conditions, they won't dismiss the symptoms that those patients come to them with, because there's already that awareness that, it's completely with this. And then they do more research, or they do more diagnosis, do more investigation around that particular condition. And then they can always say, okay, maybe it's not this, and then there's just that awareness, and you are being treated from an informed point of view, and not just that they are categorizing whatever condition you are experiencing and generalizing it, and not really giving you a focused advice on certain things that you might be experiencing that is very prevalent amongst people that come from your particular race. So it's very important that there's that awareness.
Yeah. I would also like to add one more thing, right? As a woman, if you have an interest of working in the healthcare, like if working in healthcare actually inspires you, I would highly encourage you to go for it, because you as a woman, it gives you more strength. And because when you get there, you're in that position, you're able to see people, of your kind. You see women from your race, you see women from your society, you see women just because they are your same gender. Yeah, you're able to take them seriously. Because sometimes, when you don't meet somebody that aligns with you, or you meet another gender, for example, you meet a man, sometimes it can be hard to open up, or it might be hard to get them to understand what you're going through. It would be so much easier as well if women had, more opportunity to select, or to be able to speak to another woman that actually understands, but still works in the medical field. So if you have that dream, if you have that passion that you want to ever go into healthcare, please do it. You wouldn't just be doing it for yourself. You would be doing it for the girl child and women at large, because it will really, really go a long way in reducing this gender bias in the healthcare.
Yeah, I agree with you, Hikmat. And even the racial one and access that we've been talking about, that angle is also important when we have more like Black women within the medical space. It will really help. It will go a long way. I know that we are seeing like more women in like having interest to go into medicine and all. We need more of that. It's not only because of what we've been saying on this episode, it's also because of what the data and statistics is saying. So, for example, do you know that Black women specifically are 4 times more likely to die during childbirth in the UK than white women? This statistic is very disturbing when you think about it. And I remember a few months ago, I saw a video circulate on social media. It did happen in the UK, but it was a black woman in labor, and maybe she didn't just get that attention from the nurse. There's that perception that Black women have, more pain threshold than white women and all. So the way she was screaming and all, even me watching from my screen, I'm like, she needs to be attended to immediately. But
They're asking for our ID, asking for different things, and you should give her something to relieve the pain. You should attempt, and you can collect the information you need. I know that, sometimes we need to follow the book, but we need to do that with our eyes open. What if this woman collapses and that's just the end? So we see that there's that racial bias as well, and it also affects the kind of access to healthcare that you can receive depending on your skin color. It's quite unfortunate, but it's the world we live in. So you need to understand that bias, and you need to be able to advocate for yourself. And I believe with all of these conversations we are having, and different advocates also like speaking up, adding their voices, we are going to see that systemic change as well. So whereby it's not just you trying to make a change or advocate for yourself, but the system is also supporting you to be able to do that. So that's going to happen, but we're not in that world yet. So that means that you need to, if you've been going for antenatal and you're seeing that attitude, that maybe you are not getting the attention you need, that might give you a clue that maybe this is not the hospital that you should have your child in. Maybe you want to try private and not just using NHS, or you want to mix both. You just need to try and think of how you can advocate for yourself and put your own health first, and not let the gender bias or the racial bias or the gaps that we've been discussing on this episode make it affect you in a way whereby you are like maybe losing your life or losing the life of your child during childbirth. Although no woman should die while trying to bring a life, but we need to understand that there's that racial bias as well when it comes to gender health gap and access. So now we've been talking about all the issues. It's important for us to talk about what we can do. What are the solutions, right? So there's the systemic issue, as we've said, and that systemic issue is going to be resolved through more and more advocacy. So for all advocates on gender health gap that have been doing one or two things to try and see improvements, we see you, we appreciate what you're doing. We need more people to step up and talk about these things, people at the higher levels as well, so that they know that this is happening, and there are like solutions being implemented, not just being discussed, because we need to move beyond just talk now into action. So we need more funding as it relates to women's health, so that gap is being closed quickly before it impacts another woman, before we lose another woman. Yes, and we also need training, as we've said before. So cultural competency, for example, should not be optional within the medical space. It should be compulsory. So we need more women researchers. We need more women as subject in researches as well, in medical research. We need women as researchers. We need women as subjects during research. So many years before, as Hikmat said when we opened this episode, women are not being involved in the medical research, even when it's a condition that can affect them, because there's that categorization that our hormones fluctuate and we're not the best subjects to use in that medical research. And we know that this is causing issues already, and we might lose another woman if this continues. For example, to heart attack and symptoms being missed and all that. So I don't want to repeat what we've said before, but we know that by having more inclusivity within the medical research, we can save lives. We can save the lives of women. So that's the systemic angle. So now you listening to us today, what can you do to advocate for yourself? We've said that word or that phrase like many times on this episode. So what are those actionable steps that you can take? And the first one I'll say is write down your symptoms. So don't dismiss things. Keep a symptoms diary. So if you are experiencing something today, okay, note it down that today I felt this. Tomorrow I felt this. Have that diary whereby if you go into an appointment with the doctor, you are going with your evidence, with your receipts. You are going with your diary to say, see, over the course of so months,
or so period, I've been experiencing these symptoms. What do you think this is about? Ask direct questions. Let them know that you know what you are talking about. You've done your own research even before coming to the appointments. And I will even say, before we get to appointment stage, make sure that you've researched the doctor. So I usually do this personally as well. If I'm going to an appointment, I try to go to the hospital website or go to Google, read about this doctor, what's their field, what's their years of experience. And sometimes you can get like reviews, right? You can read, yeah, exactly. Yeah, so you can read reviews, you know about them, and because you are dedicating your health care into their hands, right? So you need to know that you can trust them. You need to know that they have wealth of experience in the area at which you are facing have your medical condition, or what likely the condition is, right? So they're an expert in that field. So if you are a woman, for example, experiencing fibroid, yeah, I wouldn't say that you should base your selection of your doctor just on skin color, but I will say that because that condition affects mostly Black women, you can sort of look at people from that particular group as well, that particular race, to say who are the medical professionals here, because they might be able to relate to you better, relate to that condition better. Exactly. And they might have gotten more exposure, more training, more cases that they've dealt with, which could help you in having your diagnosis right. All right. So those are like some of the things you can do pre-booking the appointment. And part of that is also what I said about keeping your diary, your symptoms diary, so that you go to your appointment with an informed mindset that this is my data, this is what I'm feeling. And then you have also selected a medical professional that you are comfortable with. And then you go into that appointment. You ask direct questions. Don't be frightened. Don't think that if you ask this amount of question, they'll think you are too much, or you are exaggerating or not. You need to speak up for yourself. Then you can go to the appointment with someone, because sometimes if you go alone, it's easy for the doctor. I've been to some appointment where I feel like the appointment was so rushed, and if someone else was perhaps maybe with me, maybe they will be able to say, ask more questions, and it won't look like the doctor is just trying to speed up and go to the next patient, right? Or maybe there are some things that you might miss. So if you have a spouse, you can go with your spouse, you can go with a trusted friend, just so that there's someone else in that room with you, and you guys can sort of engage the doctor together, which could help with the output, or how much attention, I would say that how much attention that the doctor gives to you. So those are like some things. But Hikmat, I don't know if you have anything else you want to add to this as regards to what people can do, people listening to us today, what can they do to ensure that they advocate for themselves and that the gender health gap do not affect them in a negative way.
Yeah. So what I would like to say regarding that would be that this kind of issues and the solutions start from here. By here, I mean discussions like this of us trying to raise awareness. So if you find yourself in a position that you're listening to even this episode of our podcast, please try as much as possible to share it with every woman you know, or every man, every person that you know might need this. Please do well to share with them, because they might have questions in their head, but they don't know how to vocalize it yet until someone else speaks about it. So this is the first step, knowing what you're actually dealing with, because a lot of people are involved in it, but because, not everybody is a healthcare professional. Not everybody pays attention to their body, or not everybody knows how to put in words what they're feeling. So just being able to relate and, being able to hear someone else talk about what you're going through, it ignites the sense of advocacy in yourself, because sometimes we just might be waiting for the right push to take action. So if you're a person listening, our audience listening to this, our episode today, please share with other people that you know might need this. That is one of the ways to actually push this out.
Yeah.
world.
I agree. And I like that you mentioned that, Ikma. Another thing I will mention is when you also are in an appointment and you feel that your symptoms are being dismissed, or maybe the doctor is not taking you seriously,
Yeah.
ask directly. Make sure that they know that you are feeling that way. So you can say something like, "Oh, I feel like my symptoms or my concerns are not being taken seriously." Immediately you say that, the doctor is going to change. It's going to change the dynamic of the conversation, because they know that it can lead to serious things.
Yeah.
Yeah, they don't know who you are. They don't know who you can escalate to. But immediately you mention to them that you are feeling that way, are taking you very seriously and what you are feeling as well. So, or you can ask, okay, what are the next steps? So when they have the appointment with you, you make sure that you understand, okay, what are you supposed to do? What are the next steps on this? So they won't just keep delaying, right? So it's important for you to be able to be direct with your doctor in that conversation, and to ensure that you are like getting what you want out of the conversation, because it's a medical service that you are either paying for one way or the other, and you need to ensure that they are able to help you in the way that helps you eventually. So, and the last part will also be, as we've said before, and we just reiterate that, seek a second opinion. It is your right. Seek a second opinion. Seek a third opinion if there's a need for that. Yeah. So take it very seriously. So to recap, as regards to what you can do today to take action as it relates to closing the gender health gap, is number one, as we said before, keep a symptoms diary. Have your receipts when you're going to your appointment. Your symptoms diary should cover the dates, the symptoms, the pattern, and everything, information as possible. Number two, go with someone if possible. It really helps. Number three, make sure you ask direct questions if need be. This can change the conversation dynamics. Number four, ensure that you seek second opinion. It's your right. Do it. It really helps. And number five, also, you try as much as possible today, or as you're listening to this episode, don't just listen to it alone. Take action and share it with other people so that they can learn one or two things from this as well. So that would be like a quick recap of what we've discussed about what you can do today to take action. Ikma, I'm not sure if I missed anything, but yeah, feel free to step in here.
Yeah. So I would also say you can advocate as much as possible for yourself and also for the younger generation, as we have said earlier. Please, if you're in a position where you're a mother, a sister, someone that is just more grown compared to the younger girls that you have around you, please do pay much attention to them and, and give them an enabling environment to communicate what is wrong with them to you, and don't dismiss them. So likely you would be with them in the doctor's office when they have issues. So be there to advocate for them. You're not just following them there to just be a plus one. You should also be able to speak for them, because they might not have the confidence to speak to an older person, which is the doctor or the healthcare professional, about how they really feel, or if they even feel that they're being dismissed. So please do well to advocate for them as well, and not just yourself. Thank you very much.
Good. Thank you, Ikma. So we're going to be wrapping up now.
Yeah.
And I'm just going to say this for you listening to us today. If you forget everything else that we've said today, please do not forget one thing, which is advocate for yourself. Advocate for yourself and take your symptoms seriously. So your body is not sending you those symptoms just for the sake of it. It's for you to take action, for you to take it seriously and take it forward. So don't dismiss your symptoms. And if you feel that the medical professionals you speak to are dismissing your symptoms, please be direct with them. Escalate where necessary. There are people you can escalate to that will take you seriously, right? So ensure that you are able to document things. because the gender health gap that we've been saying is real. It happens. It's documented. There's statistics. There's data that really backs everything that we've been saying today. So don't let it hurt you before you learn from it. So please take action on everything that you are feeling. And to those listening to this as well that can make a change in the system one way or the other, maybe you work in like as a senior person in the medical space or something, there's that systemic issue that needs to be addressed. If you're an NGO that can provide funding in the area of women health research, let's just try and take action as it relates to closing the gender health gap. Do you want to close from your end as well?
Thank you very much, our audience, for listening to this beautiful episode today. Beautiful, delightful. It is packed with information that you would need going forward in your life. So please do share, report, whatever you need to do to get this out to the world. Thank you so much. And see you on the next episode. And it promises to be extra packed with insightful and interesting things.
Yes. Thank you, everyone. Thank you so much for spending the time with us. As we always say, we are not medical professionals, but we are women who truly care. We care about women's health, and we will continue to discuss topics like this. And please continue to interact with our episode, interact with our post. Don't just consume this information alone. Share with your loved ones. We will catch you in the next episode. Thank you.
Information shared on this podcast are not to be considered medical advice. Always consult with a qualified medical professional for all your health concerns. Thank you.